Hello, everyone. My name is Jonathan Weiner, and I am the Executive Director at Northwest HIDA. It is truly my privilege to announce the next set of panelists. These individuals are experts and represent a variety of professional backgrounds that are well-positioned for applying the communications toolkit to conversations with youth and community-level strategies. Our panelists include Chief Chris Guerrero, Carla Hilliard, Karen Vetch, Robert Vinson, and Dr. Caroline Dupont. Chief Chris Guerrero is the Chief of Police with the City of Kennewick Police Department in my home state of Washington. Throughout his career, he's been involved in many different aspects of policing and works closely with the community he honorably serves. Chief Guerrero embraces multiple leadership roles throughout the community, including as board chair of Northwest HIDA, where I'm incredibly thankful to work closely with him on many important topics, as well as on the Benton County Law and Justice Council, the Washington Auto Theft Prevention Authority, and is a board member of the United Way. Carla Hilliard is an award-winning educator from Berkeley County, West Virginia. After 16 years as a classroom English teacher serving in various leadership roles, she's moved into an administrative role in 2021 and is currently an assistant principal at Spring Mills High School in Martinsburg, West Virginia. Carla is a national board certified teacher and sponsor of the Drug-Free West Virginia Youth Coalition, which empowers students to engage in substance use education, prevention, and stigma reduction. Karen Vetch is the branch chief for the Drug-Free Communities Program at the National Center for Injury and Prevention and Control at CDC, where she provides strategic direction and oversight for CDC's day-to-day management of the DFC program. In her 19 years at CDC, she has helped to create new programmatic initiatives for several community-based programs and has also led a number of partnership and strategic development initiatives. Robert Vinson serves as the Associate Administrator for Alcohol Prevention and Treatment Policy at SAMHSA's Center for Substance Abuse Prevention in the Office of the Director. Rob has worked in substance abuse prevention, intervention, and treatment for more than 34 years in clinical, administrative, and consulting roles. Throughout his career, he's gained extensive experience in developing, implementing, and managing school-based prevention and treatment programs. Dr. Caroline Dupont is Vice President of the Institute for Behavior and Health, a nonprofit research and policy organization whose mission is to reduce the use of illegal drugs. Dr. Dupont's research falls within the area of addiction, treatment, and prevention. She also maintains a private practice specializing in anxiety and addiction. Dr. Dupont has authored numerous publications and several book chapters on anxiety and addiction. On behalf of the Northwest HIDA, please join me in welcoming our panelists. We look forward to hearing your perspectives on how you would apply the communications toolkit strategies within your unique roles. Thank you.
Thank you, Jonathan. And so for this last and final session, before we give our concluding remarks and connect you with additional resources, what we'd like to do is let's hear from those who could actually use it, right? Use the toolkit. We've invited different perspectives today: public safety, an educator and caregiver, the coalition perspective, Talk They Hear You campaign to see how that synergizes, as well as the One Choice campaign, a representative from that. And with that, what I'd like to do is hand it straight over to Chief Guerrero.
All right, thank you all. Thank you for that introduction, Jonathan. Thank you, Dr. Papard. Thank you to all of the staff at ADAPT, Washington, Baltimore, HIDA for all the work on putting this summit together, as well as putting together the substance use prevention toolkit and just getting everybody in the people business together, whether you're from education, prevention, healthcare, public safety, we all together are working in a business that requires interaction with people every single day. And I can tell you from the law enforcement perspective, we've been through some challenging times. If there's a profession that has to learn to adapt and adjust with the ways of our communities, it is no better time to do that than now for public safety, and that includes police and fire. We're looking at opportunities at all times to better ourselves and figure out how to provide that people business centric way of doing things to make all of our communities better. And I think that involves everybody here today, including the other panelists. And without all of you who knows what our communities look like. I know we've all got room for improvement. Law enforcement is no different, and I look forward to bettering this world with all of the other professions here. Jonathan gave a brief introduction of myself, just a little bit about where Kennewick is located. We are in Southeast Washington. Our population's approximately 87,000 people. We're strongly and fastly growing in population. Our agency is about 108 commissioned officers. We average, I would say, between 200 and 300 calls for service in a 24-hour period. We've seen a rise in crime. We've seen a rise in social issues, behavioral health issues, many of the same issues that all of you are experiencing in your communities. And we're always trying to find ways to better the situation for the underserved, for those who are trying to make a difference at all levels within our communities. And this is the forum which I believe we can make a lot of difference at. So to give you a little bit more background of how I got involved in this and where the conversation began with me, like Jonathan mentioned, I'm part of the Northwest HIDA board here, and I can tell you it takes continual work, continual effort on the HIDAs throughout our nation to bring people together and make the services we provide better. So the conversation began with us in September timeframe, where there was a public safety discussion group brought together. This group included local, state, federal law enforcement, as well as members from local fire departments. We all got together. We talked about the different social norms that were provided to us. We had a great YouTube video that explained to us really what that means. And I'll tell you what, from my perspective, it was a really good introduction into sending a positive message. I think for being a law enforcement professional for almost 27 years, traditionally, we like to instill the fear of don't do that or you'll go to jail. You know, that conversation with kids is more of a enforcement type of discussion versus a positive look in how things are done right. And when I saw that YouTube video and started going through the frames, it really resonated with me. I'll talk a little bit in the coming moments about, I have a 17-year-old junior in high school and a 20-year-old, and I'll tell you what, hearing about the social norms and seeing they all the time, hey dad, all of my friends tell me this and everybody's doing that, and look at what's happening here. And I sit back and I often would think, you know, everybody. So in my mind, everybody's 100%, right? So having the dialogues and seeing the frames and seeing the positive side of what's really occurring. And now having had the opportunity to look at the toolkit, look at the playbook in public safety, it just is so good for us to be able to share that positive message. So this discussion started in early September with the people I mentioned. It focused around the communication with the 12 to 18-year-olds, much of what we're talking about today. And we had a lot of dialogue about when are opportunities to speak with that age group, how that would look. And there was a wide variety of opportunities and conversations where, are you in uniform? Should you not be in uniform? Should you be in regular street clothes? Should you not be? How does that look? And I think at the end of the day, what we talked about, I think if you look at the playbook, I have it sitting here next to me, and from public safety, I think it's page 18 of the toolkit. It describes many of the conversations we had and a lot of those highlights. And it really boiled down to having the conversation where that 12 to 18-year-old is at. What situation are they in? Sometimes it may not be the best opportunity for law enforcement. Maybe we're interacting with the family during a domestic violence scenario. And the best thing you can do at that point is maybe support the kid, find out where they go to school, and touch bases with them later. But find out where they're at and have that dialogue. We spoke about the different frames and what frames would work better for some and better for others. We talked about the ability to maneuver between frames and really, if you have the opportunity to sit down and it's a positive interaction with a student or with somebody at a community event, use the frames that you know best. Some of the things that stuck out to me individually, like I said, I have a 17-year-old daughter, and we had arrested a individual at their school who had brought some marijuana to school, was smoking marijuana in the bathroom outside of class, and I had been aware of it, but I get home and she says, "Hey, Dad, did you hear there was a boy arrested for smoking marijuana and having marijuana on him in class?" And I'm like, "Really? Wow. Well, how many kids do you think smoke marijuana?" And she responds and says, "There's a lot. I think everybody does." And I'm like, "Everybody? Wow. Do you smoke marijuana?" And she's, "No, I don't. How about your friends?" And then I start digging in and asking questions, and I said, "I don't know the exact number, but I would venture to say the majority of kids in your school don't smoke marijuana." And she kind of gives me this look, and I said, "When you talk about everybody or most or all, what does that really look like, and what does that really mean? Do you really think do you think all of the girls on your soccer team smoke marijuana?" And she's like, "Well, no." And I said, "Okay, well then what do you think that real number looks like? Let's just talk about your grade level. What does that look like?" So we started having this dialogue, and I found, after reviewing social norms and having that dialogue, it just, was amazing. And so then I took a step back and thought, how could I utilize this within our own school district? And we have 3 high schools. We have SROs in each of our high schools. We have SROs in half of our middle schools. How do we get them to determine the social norms, the true social norms in their schools, and have that dialogue? And what do we do in the meantime? So what we're doing is we're looking at the information that's already out there nationally. How can we use the youth risk behavior surveillance system to gather data until we can get the data directly from the schools? Then once we have that information, make sure we have the messaging provided to those through the toolkit within our agency, share it with the school district, make it become something that is part of our normal everyday conversation, and then message. I think we just got to really talk about things. Within our agency, we need to put things up, let our officers understand what this stuff looks like. We do many public events. We have National Night Out. We just did Cookies with a Cop. Yesterday was National Coffee with a Cop Day. We're having a pop-up neighborhood barbecue next week. Those are all opportunities for us to be able to share messaging with anybody from 12 to 18. We can determine what schools they go to and then have that dialogue. During the public safety discussion, we talked about what success looks like. And really, for us, that success occurs when you're having that interaction with a 12 to 18-year-old and their face isn't buried in their cell phone, and they're talking about things that are going on with them and asking questions about them in a non-enforcement matter, just talking human to human and really connecting with them where their feet are. That is where success happens. How we're able to do that within our communities is continually important. And I think every contact matters with law enforcement. So it looks like I'm getting notice that my time is up. I want to thank everybody again for being part of this problem solving. Thank you for being here. Remember to mind the message. Be sure to go and make your pledge. I did it earlier before I get on. I would challenge each of you to do that. Please do it. Dr. Papard is not a broken record. I think it's something we all need to commit to doing. So please go do that. Thank you all, and take care.
Chief Guerrero, you're a rock star. Thank you for that presentation. We're going to move on now to our educator, Carla Hilliard. She's representing educators and caregivers. Carla?
Hi, everyone. Thank you. It's great to be here. I really appreciate the invitation. I'm honored to speak on this panel with such amazing people and speak to how educators can use these frames and how we can connect and empower students and young people. I work at a public high school in Martinsburg, West Virginia, called Spring Mills High School. Berkeley County is about an hour and a half outside of both DC and Baltimore. West Virginia is a wonderfully diverse state. So I am in the corner there in the Eastern Panhandle. We have about 1,500 students here. I'm an assistant principal. I'm a former English teacher. I've been working in public ed for about 18 years. So a lot of experience just working with this population of kids, this age group. And for me, when I start thinking through these frames and how they apply to having discussions about prevention and education about substance use, and we were talking about data collection, just getting to know our students is the absolute best data that we can collect. When we seek to understand our students, who they are, where they come from, what their backgrounds are, all of that is data, and all of that data we use to inform our instruction. We use it to inform how we relate to our students. So I imagine a lot of folks who are either attending this panel or speaking on this panel are parents themselves. And as a parent to two middle schoolers, we want educators not just to teach curriculum, of course, but to reach kids where they are. We want to know who they are as people, as human beings, just to echo what we just heard. So the data we collect can challenge our misconceptions and our misperceptions of young people. Working as a high school administrator, I don't think I can really fathom what young people face today. There are a lot of social pressures, access to technology, the way information travels, the way our society and our culture has shifted over the years. Young people are under a lot of pressure. Mental health among teenagers, mental health struggles are at a high. We see that every day in our school. So how we relate to them and what we can learn about our students in order to reach them and to help them is crucial. So data teaches educators how to respond in curriculum and in conversation. Those conversations can include conversations about substance use and about the decisions that they're making. The frame, agency, and self-affirmation, I really appreciate because students love to feel like they can take learning into their own hands. It's one of the most powerful things when you're in a classroom, to empower your students to be a part of the learning process. So if you remember being a student, if you have young people who are in schools in your home and they talk about just being sort of like a passive person or like receiver of information in their classroom, that removes agency from students. So I believe when we give students the tools to take learning into their own hands, their engagement increases, but their sense of autonomy increases as well. And it shows students that they can have a more active role in their schools and in their communities. A unit I used to teach in my English class was an Appalachian Studies unit called What Does It Mean to be Appalachian? So this is just a quick example of relevant learning and how that can empower students and foster agency and autonomy among students and create community and connection. Because West Virginia has been at the top of the list for drug overdoses, the center, ground zero of the opioid epidemic, one of the assignments one of the parts of this unit would challenge students to research problems in Appalachia. So students would research what issues are plaguing our region, and then they would develop solutions to those issues that they researched. So of course, addiction was at the top of the list. Mothers who had substance use issues, babies being born addicted as well. It was a really fulfilling assignment for our students because kids are impacted by substance use, either personally in their families. If you ask a room full of students to raise their hands, and if they are affected by substance use, almost every hand will go up. So when students have this relevance to their learning and they feel empowered to do their own research and to find answers and information, and their minds are, and their hearts and their minds are sparked to that there are solutions, and there are agencies and organizations doing really incredible work in prevention and education and in treatment, they feel less powerless and more powerful and engaged in in their communities and in what actions they can take. And they see themselves in the solutions, which I think is a really important point. One of the other frames, relationships. I mean, that's what we're all about in public education. When I moved into high school administration, folks would say, like, why do you want to do this work? How do you want to just work in discipline all day long? But really, working as a high school administrator, you really are just in the relationships business. Every classroom teacher I know, this is what we do. We get to know students, and we have such a privilege, and we have such a unique position to create this space of belonging in our schools, to connect to students and to seek to understand and to know every student who we encounter. But those relationships is what allows us to do the good work, to do the work of prevention and education and addressing issues and risks that our students may encounter. No work and no learning can happen until we form relationships. So if we come at our work, our content, our discipline, whether you teach health or science or English or math, whatever your content is, we approach it from a frame of relationships. And so I think it's really wonderful to bring this to the conversation about prevention as well. These young ladies are 4 of the 5 members of the student leadership team of our school-based youth coalition. It's called Drug Free WV. This is Hayden, Gracie, Aisha, and Destiny. They are just absolute rock stars, inspiring young women who make a difference both in our school, in our community, and I just can't say enough about them and their leadership. So the 2 frames that I'm looking through, or the 2 lenses I'm looking through for our coalition, is this risks of addiction and aspirations, and future goals. So we are just beginning the work of our coalition at school. And so I did want to bring this into the presentation because we do have a more targeted way to discuss drug or substance use, prevention, again, education. My students are very concerned about stigma reduction. They believe that this should be one of our goals in our work at the school level, is to normalize conversations about substance use and to provide peer support. I admire that about them. Almost all of us coming to this work have a personal connection and have been personally impacted by substance use in our families. So just a couple of pictures here and a flyer that we've shared with our student body here at Spring Mills High School. We are an affiliate of the Martinsburg Initiative, and they are just an incredible community organization here in the Eastern Panhandle doing very important work in prevention. These are goals that my students and I have shaped together. They are willing, empowered, excited, ready to get into the community and to spread the word, but from their voices and from their experiences as young people. I think it is just incredibly empowering and powerful when we pass students and we pass young people the mic. So they're not just listening to adults, but they're actually participating in the conversation. Just a couple things real quick before I'm out of time. So some of our student leaders said about being a part of this work in the Youth Coalition. Destiny, our president, says that being a part of this program gives her a sense of strength and leadership. And this is a young woman who has been personally impacted by substance use and a drug overdose. She said it helps her not only get work done in the community, but also to be there for others who are dealing with addiction, even if it's with them or someone they know. And so all of my student leaders, the common thread is that they feel empowered, they feel ready to lead, and that's what they're excited to do. So educators absolutely have a unique position to positively influence students. We connect with students, we empower students, and everyone benefits: our school, our classrooms, and our community. So I really appreciate the opportunity to share, and I think that these frames are so applicable to educators everywhere.
Thank you, Carla. Thank you so much for that. We are now going to move on to a slightly different shift, and we are going to talk with Karen Vetch from the CDC, who oversees the program management portion of the drug-free community coalitions, but also she's going to speak for prevention professionals at large, as well as other non-DFC coalitions, and how they could potentially think through using this toolkit or this type of work, the best available evidence in their roles and the work that they do. Karen?
Thank you, Laura, and thanks to everyone for joining today. It's a real pleasure for me to talk about this issue and join panelists, not just of federal partners, but also state and local partners that are working kind of on the front lines of this issue. And it's really wonderful to hear a lot of the kind of positive reinforcement and energy that relates to this issue and kind of the frames that we're talking about today. When we think about effective communication, I pulled this quote. It's from our former CDC director, Tom Frieden, which is kind of 6 components that are necessary for effective public health program implementation. And one of those is effective communication. It is such a critical piece of an overall approach to addressing a public health issue, such as youth substance use prevention, because it does a few very fundamental things. It conveys critical information, convinces key individuals to support or lead an initiative, and perhaps most importantly, change the context for public health action. And I think that's really what we're talking about today. How do we change the context, support the context that we know is out there to ensure that we're supporting our young people and promoting positive youth experiences? For those of you who are DFC coalitions and many probably local coalitions across the country, this is no stranger to you, the 7 strategies for community level change. And this idea of providing information, and providing information is critical, but it's not just informing your community about your events or your activities, making sure they know that your coalition exists, but the type of information you're providing and the way in which you're providing it and how that is working in concert with all of your other strategies to promote community level change in your communities. So this is kind of another framework, and that providing information step is so critical at the local level. So when we think about kind of communications, I think at the local level, a lot of folks get a little bit, like it's too much money to do like a media campaign. I don't know where to start. And a lot of times, and we've heard this from some of our other speakers, you can start with kind of an environmental scan and those existing campaigns and messagings that might be out there. I think this toolkit that ADAPT has created is definitely a good example, in addition to some of the other examples that you'll be hearing about today, and that you have heard about. Having those exploratory discussions with your local experts. If you're a local coalition or a DFC coalition, you have representatives from all of these key sectors that you see on the right-hand side. And what are they seeing in their community? What are the things that might resonate with those particular audiences? And like many of the other speakers have said, who is your intended audience? A good friend of mine who's a professional communicator has always asked me 2 questions. Who's your audience and what is your objective? And sometimes when you ask yourself, those 2 questions, all of a sudden, some of these things come to light. But is it youth? Is it your school leaders? Is it your decision makers in your community? And I really appreciate what Carla and others have talked about in terms of really engaging youth. A number of our DFC coalitions also have the kind of youth-led coalitions that work in concert with their adult-led DFC coalition and have seen really great results once those coalitions are formed, those youth coalitions are formed to give a sense of agency to the young people. So audience insights and certainly are integral for development in order to do this message framing. And I won't get into this slide too specifically because you did hear already from Alexandra from the National Council, and we did work with the National Council on the Getting Candid Toolkit. But the message, the point I want to make here is the message framing and the tone are so important. So the framing that that the National Council is very kind of relevant to what the ADAPT toolkit is saying too. Goals and plans for the future that they don't want to mess up. That they want to have kind of control over their own lives. And kind of this, also the risk of addiction was another thing that had kind of popped up as part of the kind of messaging that had come out from audience research. And so how can this help to frame, communication messaging? And what you see from this kind of Getting Candid message guide, which I think is relevant to also what you're seeing in the ADAPT guide, is kind of the highlights of the future, the risk of addiction, emphasis on relationship activities, and self-affirmation. The other thing I really like about the Getting Candid guide, but I also think that can be used through the ADAPT toolkit, is that the messaging can be applied outside of individual interactions. So a lot of times we think about communication being one-on-one communication, speaking with that young person, having kind of a provider or counselor speak one-on-one. But what about kind of broadly, what are some messaging techniques that can be used and through different platforms, social media, text, posters, group conversations, newsletters, and emails? And this is kind of an example from the Getting Candid toolkit, but with the hashtag #ShareYourWhy. So why is it that you are not using drugs or alcohol? So share your why, share the reasons why you may not be doing drugs or alcohol. So rather than kind of the scare tactic of don't do this, it's more providing a space and a forum for kids to share why they're not. Don't reinvent the wheel. I say this many times, there's so many resources that are out there, and how can you adapt them to your community? So obviously the ADAPT Prevention Communications Toolkit, I think is a really wonderful toolkit, and things, and I know that folks have access to that now. The Getting Candid messaging guide as well. There are a number of CDC resources. The Media Campaign Resource Center from CDC's Office on Smoking and Health can certainly, for those of you in tobacco prevention, vaping, contains a lot of free and low-cost tobacco education campaign materials that have been tested. CDC's RX awareness campaign, especially when it relates to stigma reduction and those struggling with opioid use disorder. Obviously, SAMHSA's Talk They Hear You campaign, and parents and educators from NIDA in providing kind of latest science-based information about drug use, health, and the developing brain. So look at some of these tools and resources to see if there are things and pieces of that resonate in your community. Work together. This is an example from many of our Connecticut coalitions that pulled their resources together, worked with the state related to the You Think You, and developed a campaign, You Think You Know, based on counterfeit pills. And so this is an example of coalitions coming together and banding together when they saw an kind of increase in overdose deaths among young people related to counterfeit pills, and were able to kind of collaborate with one another in addition to the state to assist them with these communication efforts. Connect with us, with your federal and national partners. I've put there are many more and many who've spoken today, but please reach out to us. And there's many things that we can provide and assist you with as you think about ways in which to communicate and have effective messaging as part of your strategy. And then collaborate with your state entities. There's many entities at the state level that can help you in your efforts. And some of these websites will identify those state contacts that you can work with that are also engaged in these activities that you can coordinate with. So if you have any questions, please contact me, and please visit our website. And for those of you who are not a DFC coalition, I really encourage you to look out for our next funding opportunity, which will be coming out in January, to apply to the DFC program and join the DFC family. Thanks so much, Laura.
Thank you, Karen. That presentation was rich with resources. All of those resources are on those slides. Those slides are available to you under that sessions tab for this specific session. So you can access all of them there. Thank you so much, Karen. Karen mentioned the Talk They Hear You campaign out of SAMHSA. Well, next up is Robert Vinson, who actually oversees that campaign and can give us the lowdown on some of the new materials that might be coming out from that. Robert?
Hi, and thanks and welcome everybody. Let me just say to all of my predecessor speakers that yes, 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 and yes. And to all those listening today, I'm hoping that I can amplify some of those things with the national media campaign known as Talk They Hear You. But first, let me just talk a little bit about sort of the context of how we get here and sort of SAMHSA's mission around some of this. So we were often referred to this in terms of finding our way. How do we help children get the right service at the right time regularly and often as we think about prevention? And we think about prevention as the front door to this system, in particular as it relates to parents and caregivers, which I would identify as really the first prevention specialist that we might have in our system. Those are the people the closest to the child every day who are making impacts there. But for those children that we're sort of struggling with, we also know that if we intervene before the age of 15, we can cut decades off a substance use career. So it's really important to have these kinds of conversations. And that is sort of the crux of what we're doing with Talk They Hear You. Now, Talk They Hear You is an adult media campaign. And I just want to be pretty clear on its focus. This gets back to what Karen and others have said about knowing your audience and being very specific around your audience. So the campaign is really focused on parents and caregivers. Now, I say that caregivers is broad, so caregivers also include schools and communities. So there's an awful lot of people in each of those. But it's important to understand, and I think most, sometimes people forget, that really children really do think the messages they get from adults, in particular parents, is a very important message. Research has really borne that out. So it's very important to sort of lean in on that a little bit. The campaign itself really, over the last several years, has really aligned its public health messaging with its interventions. So we're trying to draw a through line through everything that we're communicating, both in either a static frame or a dynamic frame, so that it's coupled with combinations of things depending on the circumstance and the context for which you're implementing. And we do that really by aligning for parents and caregivers. So there's a suite of tools and information very specific to that audience, a suite of tools and information for schools and school counseling staff and other educators, as well as for the community and both coalitions and communities more broadly. There's a little over 450 products to date. But at the core of all of that is how do we help each of those audiences really get informed, be prepared, and take action. And when I say take action can mean a lot of things, but in its simplest form and its most basic form is for parents and caregivers and adults in the life of a child to have a conversation. And I just want to lean in on some of the things that you've heard from some of our previous workshops today and some of our previous speakers. Tone matters, approach matters. The shaming and straining of parents in particular is a pretty harmful thing and has lots of iatrogenic effects. Needless to say, it also puts them in the position where they're not likely to have conversations. And that's the same for our schools and our communities. You know, it's easy, as Chief Guerrero had talked about working in his community. It's easy sometimes to point, oh, it's that community or that group, and sort of wag the finger just a little bit. The reality is that's not beneficial for anybody. Substance use is a problem, substance use and mental health, but substance use broadly is a problem that exists in every school, in every community in America on some level. Now, that being said, I want to go back to our first messages that we heard. The majority of children do not use. And sometimes we confuse that when we think about these things, that yes, there are problems and yes, we need to address them. And that really is our goal within the campaign, is to sort of put that in context and perspective as we go forward with that. We do that in a variety, both dynamic and static. So on the static side, we do print ads, radio, public announcements, fact sheets, discussion starter videos. I'll talk a little bit more about that. We actually coupled it with some individual soundtracks to sort of amplify the messaging a little bit. And a parent podcast that's really parent-centric. So these are parents having conversations about the very thing we're talking about. And how do you do positive parenting? How do you have these conversations in a way that really isn't shaming of the child or creating effects that you're really not looking for? We also do that in some skill building areas. We do this with a mobile application that really is sort of a campaign in your pocket. It actually allows you to practice these sort of conversations in a more pro-social way and think about how you're doing that. All of the work that we do with parents, really at the core of that is motivational interviewing as a base, using the spirit of motivational interviewing across the system to help parents. So when you heard Chief Guerrero talk a little bit about sort of developing discrepancy, that's in fact what he was talking about. Well, developing discrepancy is really not about pointing something out as much as it is as helping them find a different solution that, well, maybe that's not in my best interest. And so really reframing things and helping people see it in those lights. Another aspect of that that's a skill builder is what we refer to as Parents Night Out. Parents Night Out is either a 1-hour virtual session or 3 individual sessions that the more than 1,400 communities and partners that do this with us deploy, which is really designed to sort of help parents have these conversations with other peers and learn about what are the harms and risks, how do we change that trajectory a little bit, and what we might do. We do a lot of work around student assistance and have a whole webinar series and a load of activities and an administrator's guide to sort of help schools as they're making decisions around what programs to implement. Is that really as a primary prevention activity, or is that something that's a little more on the indicated side, meaning screening and referral, or for those individuals that we're concerned about, how do we help them find new solutions to improve their health, wellness, and well-being in a meaningful way? Additionally, we've produced a couple of curriculums that we're getting ready to roll out. One of those is motivational interviewing for parents and caregivers. Another one of those will be for school administrators and student assistance professionals in that frame. All of this is to say that one of the chief things that we really orient the campaign around is the 5 conversation goals, and that we're really trying to accentuate those in a positive light throughout that. Now, one of the first goal is to show that you disapprove of underage drinking and other drug use. Now, that's not to have that intense conversation like you shouldn't do that. That's to have that conversation around how is this in your best interest? How is it good for your health, wellness, and well-being if you engage in these activities? And by the way, what might you need to say or do if something arises that you're uncomfortable with? How do you, to make sure that you show that you care about your child's health, wellness, and well-being, and that in those conversations that it's always centered around their success, if you will, their agency as part of the dynamic part of the frame. Show that you're paying attention, be present, as I like to refer to it as. This is just paying attention to the subtle cues and the things that are sort of important and going on, because sometimes they could be involved in something or in a situation that if you're not paying attention can escalate rather quickly. And then lastly, help them build skills, give them opportunities to practice. Where we have our community coalitions and other folks there, oftentimes we refer to this as skill building activities, and many schools and programs do this with regularity. That being said, all of our PSAs, we were about just shy of 20 billion impressions to date in all 50 states and 300 cities around the nation, really are modeling various aspects of either dynamic framing or static framing, depending on. But most of it's pretty dynamic in terms of modeling those conversations. In particular, our 3 discussion starters. The first one is Talk to Hero. It is about a 10-minute discussion starter that walks through an entire relationship on 2 parents and 2 children and an issue that happened at school and how you might frame that in a positive way and how you might engage it. The second one is really around schools and student assistance kinds of work, and that's referred to as By Your Side. And there's a 10-minute discussion starter there that literally walks through the importance of all of the parties in the schoolhouse and the community that make a difference in the life of a child, and why it's important to be present for them and paying attention and to have these conversations early and often. Lastly, soon to be released, will be our community focus, and that one is titled This Life for Us. This Life for Us illuminates the importance of community and all of the players that touch and impact a child's life every day. Each one of these comes with a discussion starter guide to help the particular audience that you're targeting have a conversation and work that through. And as much as anything, to raise the awareness in the community or the school or with the parents so that they have a grounding of where to go next. There's a series of community engagement resources that we provide to all of our partners. It's a toolkit very much similar to some of the toolkits you've seen here today. And then lastly, the last new release we have is, should you find yourself in a situation where I refer to it as the panic button. We're in the process of right now of rolling out and delivering Screen for Success, which really is a multi-dimensional screening tool, self-screening and referral tool that helps a parent or caregiver who may think their child's in trouble find resources and understand to the extent of what that problem might be. And with that, I'd like to say thank you to my colleagues and all of those that spoke today, and turn it back over to our leaders here.
Thank you, Robert. Thank you for teasing out the Talk They Hear You campaign and offering some other insights specifically around communicating with youth and the role of caregivers, right? And educators who could be included in that role. So we really appreciate you giving us a little more information on that. While he does not have slides, we've got a direct link to the Talk They Hear You campaign in the toolkit as well as in your resource supplement. So you'll be able to access those resources there. At this time, I'm now going to hand it over to Caroline DuPont, who is the Vice President for the Institute for Behavior and Health and has been actively involved in a campaign called One Choice. And she will describe a little bit more about that and how it relates to what we've been talking about all throughout the day around social norms. Caroline?
Thank you so much. I'm so thrilled to be here. It's a little intimidating to come after so many great speakers today. I've really enjoyed just being a viewer of all these great talks today. And so I'm going to be sharing some of my information, and I hope that it's useful to you. I think it will be, and I hope you're as excited about it as I am. So this is One Choice for Health, an evidence-informed, youth-led prevention message. One choice is a shorthand for saying no use of any alcohol, nicotine, marijuana, or other drugs by youth under the age of 21 for reasons of health. Might be a mouthful, but it's a clear health standard analogous to other health standards like wearing seatbelts, using bicycle helmets, eating healthy foods, exercising, getting 8 hours of sleep. The thing that a health message has in common is they all are based in science and data. And One Choice is a health standard also supported by science and data. It can be used in conjunction with any prevention message, any program, and it's easily incorporated with positive social norming campaigns. One Choice has three main components. The first has to do with the uniquely vulnerable developing brain. I suspect most of you already know this, but the human brain continues to develop well into the mid-20s. And that means that anything that happens to that brain during those periods of development can have a big impact on that person, not just in the present time, but into their future. One of the things that we're obviously concerned about now is preventing substance use disorders. And we often think about substance use disorders as being adult illnesses, but in fact, they're pediatric onset diseases. 9 out of 10 adults with a substance use disorder will initiate substance use before the age of 18, and sadly, often way before the age of 18. And the earlier and the heavier that use, the more likely it is that that person will develop problems later in their life. All substance use by youth increases their risk of adverse health outcomes. And as a psychiatrist, one of the things I'm most concerned about that is with mental health problems. The second component of One Choice is that for teens, all substance use is related. We looked at data from the big national survey on drug use and health. So this is a nationally representative sample of 17,000 youth ages 12 to 17. And we looked at that data in a new way, and we asked the question, is the use of one substance by adolescents associated with an increased risk of the use of other substances? And the short answer is, yeah, it really is. And this is a series of 3 slides I'm going to show you that show that relationship. It may look kind of confusing at first, but I'm going to give you a quick way to look at it. Again, big national survey data, teens age 12 to 17. On the left side, you see where it says no past month alcohol use. So those are the 12 to 17-year-olds who said they had not used any alcohol in the past month. On the right side, it says yes, past month alcohol use. Those are the 12 to 17-year-olds that said yes, they did use alcohol in the past month. If you just, that's then further divided with some alcohol use, binge drinking, and heavy alcohol use. If you just eyeball this quickly, you can see that no past month alcohol use has little bars. And what that means is that the students who didn't use alcohol in the past month also were unlikely to use marijuana, other illicit drugs, or cigarettes, nicotine. But the ones who said, yes, they did use alcohol in the past month were much more likely at each of these different steps to use these other substances. And so just zooming through that quickly, you can see that these are, you don't have to be a statistician to see these are really big differences. This is the second slide in this series, and it's that same data set with the 12 to 17-year-olds. And what you see again on the left side is the students who said no past month marijuana use. And on the right is the yes past month marijuana use. And you can see on the people who did not use marijuana in the past month, little bars, they were unlikely to use other substances. But the people who said yes to past month marijuana use were much more likely to use those other substances. The third and final slide in this little section is you're looking at cigarette use. Now, I wish it said nicotine use, but the study originally asked about cigarette use. But we do have data that shows that nicotine with vaping or other delivery devices follows this exact pattern. Again, you're used to this now, 12 to 17-year-olds, no past month cigarette use, little bars, unlikely to be using other substances. But if they did say, yes, they used cigarettes in the past month, they are much more likely to be using these substances. What these slides show us is that it really boils down to one choice. Are you going to make a decision to use or make a decision not to use? Because once you make that decision to use, you're much more likely to use other substances as well. The third component of one choice is that youth substance use is not inevitable. And this is, as you've just all been hearing, is so important to our social norming campaigns. It's really fantastic to be getting this information out here. Instead of perpetuating the false narrative that youth substance use is inevitable, or it's a rite of passage, or it's just a normal part of development, we here, all of us, can be part of breaking that narrative and sharing this data that really shows that it's not true. So look at this. This is big data again. This is monitoring the future data, and for the past 40 years. And we went straight to the high school seniors because that would be the most likely that people are going to be like, everybody uses. Nope, that's not true. Look at this. This is lifetime non-use. These are high school seniors. 30%, more than 30% of high school seniors have never in their lifetime used alcohol, cigarettes, marijuana, or other illicit drugs. That is huge. But if you're talking to some adults, they may have been in school back here in the 80s, and so they have a different worldview. So this is really important to see. And now, I think that was helpful to see. Look at this. This is past month non-use. And past month non-use is really, to me, in some ways more exciting than lifetime non-use, because this isn't a purity pledge or a moralistic thing. This has to do with a health choice. You might not have worn your seatbelt yesterday, but you can get more information and start wearing your seatbelt today. Look at this, almost 60% of high school seniors have not used any of these substances in the past month. That is really exciting, and that's very different than the message that we're getting that everybody uses. So who can make one choice? Everybody can make one choice because it's a health standard. It's like who can wear a seatbelt, who can wear a bike helmet. So teens who've never used any substance, of course, teens who may have used in the past, but are going to make one choice now on the basis of brain protection and the information that they've learned. Also, individuals with a substance use problem, even a substance use disorder, they can make one choice, including anybody in early or long-term recovery. Obviously, not using substances is a hallmark of recovery. So one choice is a message and information that can be used at any age and with any grade. You're never too old or too young to protect your brain. And I really am excited to show you this. This is a use of this same messaging in the a positive social norm campaign. This is these wonderful tiles that say, I am one, I make one choice to be drug-free because. And it allows the students or the youth to make their own statement about what their reason is. Why are they one choice? Why are they one? And every person has their own unique voice and their own reason. Maybe they're an athlete, maybe they have academic aspirations, maybe they have substance use in their family and they want to protect themselves from that. So this is a wonderful opportunity for people to not only solidify their own view, but to have that view amplified. And if you can see these tile walls, we've had a bunch of organizations all across the country use it, and it's really stunning. And it's powerful for both the people who do it and for the people who witness it. When it was first done, it was done with high school students, but then shown to middle school students. So it can be used in a lot of different ways. So that was good, but I think it's better than hearing from me is to hear from the students. So I have this fantastic video that some students from RIACT, who are in Rye, New York, put together that is a targeted PSA, peer-to-peer messaging, just this information we've been talking about, but they say it faster and they say it better. Play the video, please.
I thought smoking a little pot wasn't a big deal.
The truth is, for teens, all drug use is connected.
Lots of people are worried about what they think of as dangerous drugs.
What they may not realize is that teen substance abuse is dominated by three main drugs: nicotine, marijuana, and alcohol. But thanks to new research, we now know
the use of any one of these three substances makes you more likely to use the other two, and to use other drugs.
Did you know teens who use marijuana in the last 30 days are
5.6 times more likely to use alcohol, 7.9 times more likely to binge drink, 15.8 times more likely to report heavy alcohol use, 8.9 times more likely to smoke cigarettes,
9.9 times more likely to use other drugs than their peers who didn't use marijuana in the last 30 days.
Did you know that the same corporations behind big tobacco in our parents' generation are behind big marijuana now?
But we don't have to buy into their old playbook.
You can make one choice to be drug and alcohol free.
And you're not alone in that choice. The truth is, most teens make the healthy choice to not use substances.
I am one.
I am one. I am one.
I am one.
I am one.
I am one.
I am one.
I am one. Join us.
I love that. I hope you guys like that as much as I do. It's just great to hear the voices from the kids themselves. So in summary, one choice has to do with knowing the science of the developing brain, understanding the data that for youth, all substance use is connected, and supporting the trend that youth are making one choice already, and it's our job to support them. Thank you so much for this opportunity. It's been a pleasure to be here with all of you here today.
Thank you, Caroline. All right, so we do have some questions that have come in. The first question, I think some of these we can knock out pretty quickly. Robert, is the Talk They Hear You podcast offered in Spanish?
It is not yet. We are working to bring some folks in. It's sort of a broad brush kind of approach as a podcast, but we are recruiting some folks. And so if you happen to have some interest as a coalition and being on a podcast, we would love to entertain that. So, but we're recruiting right now for that particular issue.
All right. Thank you. Another quick one. Let's see. Karen, can those who have received DFC funding previously reapply for DFC funding in the future?
So as for the DFC program, there's a number of statutory requirements. One of those requirements is that there's a 10-year funding limit. And so if you've received, as a coalition, received funding for 10 years, then you are no longer eligible. We define a new coalition that has new leadership and sector representatives, has a new action plan, is addressing kind of a new area, and in kind of a new geographic area, and kind of new approaches. So I hope that answers the question, but I think there's many communities out there that actually have never received DFC funding also. And so we're open to, spreading far and wide the DFC program, across the country.
Thank you, Karen. I've been told I need to talk louder, so I hope I don't sound like I'm yelling for the rest of these. So the next one is, Caroline, do we have dates? Do you have dates for the substance use slides that you presented? Can you speak to the dates on that data? Oh, Caroline, I think you're on mute.
Sorry, I was muted, sorry. Yeah, I'm not sure which slides they're discussing. The dates that are the 60% has gone up through 2019.
Okay.
So it's all current.
Thank you, Caroline. Carla, we actually have a mix of questions here. So Carla, the one for you, here we go. I represent a drug-free community coalition in Miami-Dade County, Florida, the fourth largest school district in our nation. What message, or how should we frame our message in the way that will be the most influential in opening a door to administer surveys at the school? So it sounds like she or he is wanting to administer surveys at the school. How can they frame their message to rally support or buy-in into that objective? She says, or he says, we struggle because of the mindset. There is not a drug problem in our school, which we know is not fully accurate.
I think just to normalize this conversation as much as possible, to remove the element of shame from students as much as you can. Our messaging here is let's do good work together, and students appreciate the call to action. So it's kind of two parts. So removing the shame and the stigma of discussing substance use or substance use disorder, and then also working in a call to action. So asking students to be partners in whatever work, right, that you're intending on doing in your school would be my advice.
Thank you, Carla. And then we do have a comment. It's for the chief. It says, no question, but bravo, chief. So well said. Thank you. So I wanted to pass that on to you, Chief Guerrero. And then the last question we have is really for the whole group. And so I'm going to open this up to all of you. The last couple of sessions have focused on correcting misperceptions with the assumption that everyone does it. How can we craft social norms messaging that can appeal to people who perceive and identify with the idea that they are different from others, such as people who think, I'm not most people, or I'm not like the others? Ideas from the panel.
I'll just go ahead and jump in just from the school perspective. Students respond really well when you say you're doing the right things. We see you doing the right things. We see you making the right choices. When you can provide survey data and other data you've collected to support that through the social norms, I think that would strengthen that even further. But I see students respond to the idea that they aren't like folks, they're not like their peers, but they're especially not like their peers when they're recognized for their efforts and for doing the quote unquote right things.
I think reminding people that positive difference is good. Being a different person in a positive way is positive, and everybody's got that. It's just identifying it for that individual. And that's where I think the social norms are amazing, because it hits on the positive side of things instead of, you know, just looking at the negative and believing that everybody does do something when that is not the case, and reinforcing that messaging over and over with every interaction is where that difference gets made. But you got to be willing to have the dialogue and have discussions and get engaged. especially with kids. Why would you not, right? We're adults and we just need to get engaged. I think it's that easy.
Sometimes I think we hear this when people are concerned that they can't find other people that I call one choice kids, other people who, for example, are non-users. It seems like they're surrounded by people who are making different choices than they are. And so I really encourage people to reach out and to think about different organizations or groups in school, or even different adults that they could talk to about that in order to find those peers. Because sometimes the non-using students fly a little under the radar, so they're not as easy to locate as those people who are using.
I would add into this. I want to go back to something that was said earlier, the importance of agency. And my first comment to the young person that might say that is, you're right. This is your life. And so let's talk about what's good for you. And to Carla's point, it's about how do we do good work together? What we want is to help you be everything you can be. So if you're involved in things, or you know others that are involved in things that may be problematic or put you at risk, we'd like to help you find different paths to do that should you need them. Otherwise, you should know you're in good company. Most don't use, and that's a very powerful thing. But this is your life. It's your agency. And sometimes I think we miss that. I usually start these conversations out with kids as, you're right. This is about you, not me.
And I couldn't agree more. And I'll just add that I think that from a coalition perspective, or just kind of supporting coalitions, that providing that pathway for youth to become engaged in the work and be involved in those types of activities really kind of bring folks together and bring different folks together. And the way in which to kind of convene and bring folks together, I think, is something that coalitions are so great at, and especially those that can kind of convene those different groups and create that agency and space for folks to act.
You know, I honestly can't think of any better way to wrap up this session than with that question and your amazing responses to that. Whoever submitted that question, thanks so much. Listen, you guys are all bright lights in this space, and I want to sincerely thank you for joining us and sharing your ideas of how to bring communication to life, specifically for the purpose of substance use prevention. Thank you so much. All right, we are at our last final, very short session. We are going to close this out. We will see you at the final remarks, where I will be introducing you to some ideas of what we will be putting together for you activity-wise to support you in minding the message. We will also hear closing remarks from Deputy Director Jamie Delano. So we'll see you over there.